Today I would like to talk about inflammation and testing for it. Some of you may have seen the word CRP in your health checkup results, or you may have worried that your body has been feeling tired lately. But could it be that inflammation is occurring inside your body? This time, based on medical knowledge such as the article from Harvard Health Publishing, a highly reliable information media run by Harvard Medical School, we will break down the basics of inflammation. We will look at whether testing is necessary and what measures we can take from today. First, let's start with the basics. What exactly is inflammation? In a nutshell, inflammation is a normal defense reaction used by the body to fight against foreign invaders and damage. For example, imagine falling and scraping your knee, or when bacteria or viruses enter your body. The wound may become red, swollen, warm, and painful. This is evidence that the body's immune cells, your bodyguards, rush to the scene all at once. They are working with all their might to fight the invader and repair damaged tissue. This defensive reaction can be broadly divided into two types. 1. Acute inflammation. Think of it as firefighting activities for large fires. Inflammation that occurs when you have an injury, cold, or influenza. Although severe symptoms may occur, once the cause is removed, the immune system withdraws and symptoms return to normal within days. 2. Chronic inflammation, neglected to gradually spread blemishes. Here's the problem. Even if there is no obvious trauma, a small flame continues to smolder inside the body. This chronic inflammation gradually damages normal cells and blood vessels over many years. So why does chronic inflammation occur? The main causes include everyday factors. A poor diet, meaning too much ultra-processed foods, saturated fats, and refined sugars. Accumulation of visceral fat through obesity. Visceral fat is not just a clump of fat. It is actually a source of inflammation that constantly releases inflammatory cytokines. Lack of exercise, excessive stress, smoking, excessive drinking, and chronic lack of sleep. If this chronic inflammation continues, the risk of serious diseases increases significantly. Arteriosclerosis, heart disease, and stroke. It damages blood vessels, making them likely to clog. Type 2 diabetes, where insulin becomes less effective due to the inflammatory environment. Cancer, as cell genes become more vulnerable, and even dementia like Alzheimer's disease. Autoimmune diseases such as rheumatoid arthritis are also linked to this silent killer. If you're that scared, you might want a blood test to find out if there's inflammation. The main inflammation tests or markers performed at hospitals include the following: CRP, or C-reactive protein, and its high-sensitivity version, HSCRP. It is like a fire department emergency dispatch alert, measuring the strength of inflammation. ESR, or erythrocyte sedimentation rate. It measures the rate at which red blood cells sink. When there is inflammation, proteins cause red blood cells to stick and sink more quickly. Ferritin, normally a repository for iron, but it jumps when inflammation is present. Fibrinogen, a protein that helps blood clot, also increases during inflammatory states. These tests tell you if inflammation is occurring, but they have a key limitation. They don't pinpoint the location. We don't know if the fire is a cold, stress, or a serious illness. Should healthy people be regularly tested for inflammation? This is a crucial question. The conclusion by Harvard Health Publishing is that there is basically no need for screening. Caution 1. Unnecessary anxiety. Even a minor cold or muscle pain can cause a jump in levels. Testing lightly can lead to unnecessary imaging tests or additional expensive procedures. Caution 2. Even normal numbers aren't absolutely safe if your lifestyle is disrupted. When is an inspection necessary? When a doctor suspects a specific disease like rheumatoid arthritis, or to monitor treatment effectiveness for diagnosed conditions like inflammatory bowel disease. It is also useful when making a comprehensive judgment of heart disease risk using HSCRP. Rather than worrying about measuring, improve the habits that cause inflammation. 1. Diet. Increase intake of vegetables, green fish, whole grains, olive oil, and nuts. Avoid processed meats. 2. Continue moderate exercise. 20 to 30 minutes of aerobic exercise a day is powerful. 3. Ensure quality sleep. Sleep deprivation is stressful and increases inflammatory markers. 4. Weight management and stress care. Reduce visceral fat and balance your nervous system. 5. No smoking. Tobacco is one of the most powerful inflammatory substances. To summarize, inflammation is a protective mechanism, but chronic inflammation is a risk. Tests can tell you if there is a fire, but they cannot pinpoint the location or cause. Focus on reviewing your daily lifestyle habits, eating, exercising, and sleeping. If you have worrisome symptoms like prolonged fever or joint pain, please consult a doctor. Take care of your body and adjust your life little by little. Thank you for your attention. Please subscribe and give a high rating if this was helpful. See you in the next video. See you again.